Hi and welcome to NRCC Business Talk. You all heard of Dr. Leahu, Klinici Leahu, the Leahu Clinics, and the guys here with me. Hi and welcome.
Hello.
Thank you very much for being here with us.
Thank you for your invitation.
First of all, why member of NRCC? You don't look Dutch. I don't think you are. So why?
First of all, we are always looking abroad because we have a strong position with patients that come from abroad to be treated here in Romania.
Okay.
So we are always interested to have our message heard abroad. And also we are thinking about expanding into Europe and
opening up
clinics over there. Yeah.
Yeah, I had this experience with a guy at Starbucks, and I think it was Germany or France. No, it was France, in Paris. And where are you from? You know, I had this discussion with the barista, and he told me, "Oh, Romania. I need to get there this fall because I need to do a teeth." I said, "Well, why don't you do it here? Because here's like 4,000 euros."
Yeah, and it's not only about cost, it's basically about technology nowadays.
Quality.
Because quality, yeah. And the ability, because we use the latest technology, we have the ability to treat complex problems into a very tight time frame. Because this is the issue nowadays. Everyone wants it yesterday, eventually, but at least tomorrow. Okay, so that's why we are very focused on that, and basically the NRCC helps us connect with people that own businesses, and that also it's a common ground. We all have teeth, and we all need to maintain them or replace them.
Now, being a member of NRCC is bringing you some benefits towards communicating exactly that. How does it work?
Basically, when we are opening a new clinic or we are expanding in a new city, or we are able to communicate this to all the members, and also it helps us when we go to the knowledge centers, and we can learn, and also my team can learn from people that are also member in the NRCC, because basically it's this multifaceted information change. So basically we provide information about our business and about keeping your teeth healthy, and we always learn how to communicate better, how to manage better, and how to pay our taxes better.
Okay, that's interesting. Now, go into this. How did your business start? You don't look that old to have such a large business. So what was the idea? How did it grow so fast?
Basically, after I finished my faculty, I studied here in Bucharest, and after I finished my faculty, already I knew that there was a need in Romania for dentistry that was medium priced and where you can find all the options. So to start with a team, that was in my mind. And every year, the reason that we kept growing and we keep growing faster and faster is that every year we say, okay, let's see, can we treat any Romanian that is coming now to our clinic, or any patient from abroad? Do we have all the specialists that we need or the technologies that we need? Are we still able to treat any kind of case in 1 week? So there are some key factors for us.
So medical tourism is actually based around a very short period of time with people.
Yeah, and actually oral procedures and all the technologies help us to treat any patient in 1 week. So the idea is when you go to the dentist, we want to provide you with an excellent experience. And that starts with a low number of visits. Because even if you are staying in Bucharest and you need to visit one of our clinics, there are always issues with traffic, with finding a parking spot, and reserving that time away from your business, from your family, to keep your teeth healthy. So that's why every visit should count. And basically, we started from that idea. The company that we are currently expanding started in 2011. Each year we had the growth rates up to 100%, and for the last 3 years, let's say we slowed down to an 80% growth rate. And now we are in the point that we are starting to expand nationally. We opened a clinic.
How many clinics today?
Now there are 5 clinics opened, and 2 more.
All in Bucharest?
No, 4 in Bucharest, 1 in Pitești, and to the end of the year we're opening 1 in Timișoara, and we already have a location in Cluj that we're going to open next year in spring.
What is the percentage of clients coming from abroad and local clients?
We have, it depends on the month. So in the summer months, I'd say we are up to 30-40% of people that travel to to receive treatment. During the autumn and December, let's say that percentage goes down to 10%. But the idea is that we treat a lot of Romanians that have left to work abroad, and now they are coming back to receive better treatment
Too
here.
many caption. So, strawberries. Okay.
Not only because there are a lot of Romanians that also, for example, we are treating doctors. We had a neurosurgeon that is working in Germany, and he came to fix his teeth.
And they trust Romanian doctors better, or why?
Because Romanian doctors are well known all over Europe, and because we have a really nice school system, and also because we are more open to new technologies. Because this is what happens in Europe. All the dentists are pretty old right now, so that's why they are used to work. They are used to work for the last 20-30 years with the same technologies, and they have this resistance to change. This is not happening here in Romania because we started growing with new technologies. So basically 7 years ago, when we started to grow our business, we started with all the new technologies, and we are constantly looking for better ways and easier ways to fix the patient's problem.
Now, you grew extremely quickly. How did you manage to do that in terms of financial needs? Because, you know, a company does have that. Financial, marketing, and talent.
Yeah. From the financial point of view, the banks always stepped up to help us achieve that. So we always grew by investing all the profits that we made last year. That represented about 20-25% of the investments of the next year. The rest was coming from the banks. And this helped us to increase our facilities, so we can treat more patients. Regarding talent-wise, we always attract new doctors. We always attract doctors that are currently working in their own little private practice that want a team, because we are all about the team. Because nowadays,
So you're basically bringing more customers to each doctor.
Yeah, and the mix of the mix side, yes, they get more volume on the things that they are really good at. So basically, we have doctors that only do root canal treatments. We have doctors that only work a special machinery that can do crowns in 1 hour, full ceramic crowns. And it's a lot working on the computer and also in the patient's mouth. So this is the idea, is that every doctor is really good at a specific thing, and because we have lots of patients, they can really fast become a specialist in that field.
So your focal point is, when I go to Dr. Leahu, I'm gonna get a specialist with
you'll get a team, and you'll get a team, and each member of that team has already passed that 10,000 hour mark. You know, because to become an expert,
like the pilots,
to become an expert, you need to put the time, and that time people calculate to 10,000 hours. And the idea is, doing 10,000 hours the same thing, you become an expert, even if you, I don't know, if you don't have the greatest talent. But we are also looking for that, because providing real help to our patients means this team approach. And when you'll come to visit us, you first of all, you'll receive a consultation from a coordinator, and then you'll receive your team. Because usually when you grow up, you need a doctor for your gums, a doctor that fixes tooth decay, a doctor maybe that straightens teeth, a doctor that puts crowns, a doctor that puts implants. I'm the implants guy, one of the implants guys, because we have a really strong team for oral surgery, because we are fighting with tooth loss, and especially with that situation where the patient loses all their teeth. And this is a common thing not only here in Romania, but all over the world. For example, in the United States, there are 30 million people without any teeth in their mouth. And,
really?
Yeah, it's a really big thing, because now the population is getting older and older, and now we are living longer. So there are statistics that says that
so now I know who votes for Trump.
Yeah, toothless.
Finally. Yeah, okay.
Toothless. But we are really well known for also for this kind of procedures, when we put implants and teeth the next day. So in 24 hours, the patient receives a new mouth, basically.
Wow.
Yeah.
Incredible. Now, is this the only thing? Are these the only things that are distinguishing you from the competitors? Is there a trade secret that you might be able to share?
I think
What is the extra mile?
the extra mile is that we are always focused on the patient. So it's not about the doctor, it's more about the patient. Because usually what happens with clinics that have really good doctors, eventually the doctor says, oh, it's enough for me, or no, I cannot manage more than one clinic, and they stop. And if the patient wants to get treated, they need to be scheduled after 3 months, after 4 months. And basically, from the start, we are building this system in which always you will find a doctor that can treat you. Because there are a lot of patients that postpone treatment for dental issues for maybe 10 years, 10 years, 20 years. But when they finally decide, okay, I want to fix my teeth, then it's our duty to be available and to say, okay, we can do it this week. You want this week or next week? So it's not up to us, to our schedule. It's up to the patient. Mm-hmm. So that's why and it is our main issue. We want to provide excellent care that will become normal care. So you can find anywhere you want to go, you'll find the Dr. Leahu Dental Clinic, and you'll find a team of specialists that can treat you in the same conditions. And this is our focus.
Standardized.
Yeah, because dentistry, we've seen this in general medicine.
We all believe it's a gamble.
Yeah, in general medicine, we have some standards, okay, and there are a big chain of general medicine clinics. But in dentistry, it's a gamble, exactly. You never know what you're going to get when you are going to a different clinic. So that's why we want to take that away for the patient. It's stressful enough to have problems, to have procedures done. It's better that we take the chance away from that. So you are sure that you'll receive real health and an excellent experience going to the dentist.
What I remember, 5 years ago, there was this diamond thing, where you put diamonds on your teeth. Is that a trend that's still on, or is it gone?
Now,
what's the latest?
The trends now it's with veneers. So basically, veneer your teeth with full ceramics and going with the extremely white smile. So if we are talking about trends, we are talking even whiter than that. Okay. We call that alien white. So it's
alien white.
Yeah, it's not normal white. Okay, and it's basically a choice. There are people who have mostly good teeth, but they say, okay, I want to go to the next level. I want to have that Hollywood smile, that alien white.
Yeah,
so,
or maybe if I'm biking and the car comes from the other
that's,
side.
This
could be used as a reflection device.
Yeah, this is an elective procedure. So that was, again, the thing when you put a stone on your tooth, that was an elective procedure. It's not because you have a tooth decay and we need to plug it. Okay. So this is the latest trend is this, and we are coming with the technology that helps us to make those veneers in a couple of days. So 1 or 2 days we can change a person's smile.
What I saw, and I saw a lot of advertising recently, including Bucharest, outdoor especially. Implants in 1 day, new teeth in a week. I mean, this is getting crowded in terms of how many people are saying that they can do this. Are they all legit?
It depends.
How should I look at this market right now if I'm in the market?
From the patient's perspective, it's really hard to make the right choice nowadays. The idea is that the thing that we need to understand is that nobody is looking at the market. So there isn't like an institution that checks everything that things are being done right.
You need to check them yourself. Nobody else does.
Yeah, exactly.
Okay.
It's the patient's job. So basically what we had done and we are continuing to do is we teach the patient, we give the patient all the information that they need so they can decide for themselves. I believe this is the only way that we can move dentistry forward in Romania and also abroad. Basically teach the patient how an implant should look, okay, how to choose a right implant, how to choose the right team, and the simplest way to approach this issue is to always go for a team always go for a big dental practice that has an X-ray machine on site, so you don't have to, okay, we need to stop today, I need an X-ray, go to the X-ray center and then come back tomorrow. Okay, from this point of view, you need the X-ray machine there in the clinic. So these are the very least that you need to look at when you are choosing a dentist.
Now, prevention, education. Are you involved in any initiative towards that effect?
Yeah, we are involved in several layers, and I'm calling layers because we are doing with our dentists, we are going into schools, we are going to kindergartens, and we are looking and teaching children how to keep and maintain their teeth, and also we are sending message to their parents so they have the knowledge about their children health. And also we are involved, our special kids department is involved into a project where they go with a mobile office to the countryside and they provide treatment and consultations for the kids in places where there isn't any dentist.
Are still places where you cannot get access to healthcare, dentistry?
There are a lot of places. So
really?
Bucharest is really crowded. Other big cities are really crowded, but when you go outside of Bucharest, it's really hard to find a dentist. And another layer that we are involved is we are trying to change the legislation. We want to provide better healthcare to children. And better healthcare means that we need to improve the access, and the state needs to pay for the treatment of dental issues with children. Nowadays, the health ministry and the insurance house, there's a rule that, okay, you can have free treatment for your child, but inside the doctor's plan. So basically a doctor receives a budget of around 1,800 lei for 1 month to treat how many children you can.
Fill in the quota is okay.
Yeah, so basically you can treat up to 3 children per month, and that's impossible. So they are allocating now up to 2% of the whole budget for health for an issue that affects almost 80 to 90% of the children, and not only children. Let's talk about also the adults. So this is what we are trying to change, and our first step was to sign a contract with the National Insurance for Health, and we are basically the only chain of dental clinics that provide this service to our patients. Now it's really limited because these are the conditions that we need to work with, but we are fighting to increase that. We are fighting to go, okay, we need to choose children up to the age of, let's say, 14 at least, and say, okay, for this generation, we are fixing everything. And that generation can grow up with teeth, because in Romania we have this issue that you always see people also on the street, also in the supermarket, people with no teeth. And this is a sign of maturity for our society. And I believe that the next step will be, okay, let's treat the teeth first.
You also do CSR. This is
exactly.
I don't think you're making too much money out of this. You probably.
The idea is that if my main goal was to make money, I would have stayed in the bank industry. Okay. Because I worked in the bank during
I heard about those guys.
During my student years. The idea is I want to change something in Romania, and the thing that I think I can influence, and I'm seeing results already, is the dentistry field. So we are not looking for the immediate profits with these ventures. We are looking to change a mindset and to improve the lives of people in Romania who, all of them, need teeth.
And a smile.
Exactly.
Yeah. Now, speaking about smiles, what NRCC event do you like the best?
Now, I believe Orange Night is my favorite, even if I missed one. I missed an Orange Night because we had another event in that time. And also, I like the CEO dinner because I have an opportunity to interact with other business owners or CEOs of different companies. So I can understand better what's the business environment here in Romania.
Which event can we meet you at? Which event you're going to be present this fall?
This fall we'll try to be more with the network drinks because that's always a good event to meet people. We are also coming in Cluj because also we are opening our next clinic there in Cluj, so we'll have a better presence there also.
Well, I'll see you there then. Thank you very much.
Thank you also.
Dr. Leahu, Clinicile Leahu for NRCC Business Talk. See you next week.